Hello friends, myself Dr. Alap Bavishi. I am Director and Consulting Ophthalmologist at Bavishi Eye Hospitals, Ahmedabad. We are running two clinics just now in Ahmedabad, one in Relief Road and another is Nehru Nagar. We are soon going to start our third clinic at iconic Isanpur, Ahmedabad. Today I am going to talk about diabetic retinopathy. As a medical retina person, diabetic retinopathy is very dear to me, and I am going to explain about the disease and some facts about the disease. Mainly diabetic retinopathy occurs due to diabetes. Actually, for understanding diabetic retinopathy, first we have to understand diabetes. What is diabetes, and you should get yourself checked for diabetes, because some facts are really disheartening. In world, just now 63 crore people affects with diabetes, and just now around 7.7 crore people in India affect with diabetes, in which we should know that 50% people are undiagnosed and they don't take treatment for diabetes. Mainly, we should understand that diabetes affects all over our body, each and every part of our body, in which eye is affected in 1/3 of the patients. Important data you should remember that in India, Gujarat is becoming capital of diabetes. And just now, highest number of cases are in Gujarat in India. Lifestyle modification are the main modifications to prevent the diabetes. First, how it affects the eye, that I will explain. In eye, there is a retina. What retina does? Whatever rays of light comes into the eye, that will directly reflect to our retina first, and retina will process the images with our brain, and that will give you clear quality of picture. But if there will be there are two parts of retina. First, you should understand one is macula and another is periphery of retina. 90% of our vision is at macula, and periphery of retina will be having multiple vessels. That multiple vessels are important to nourishment of the retina. Vessels get affected, edema will develop at the macula. That I explained that 90% vision is at macula, and if there is edema at the macula, then there will be problem. This is the process which you should understand, that why diabetes and diabetic retinopathy and why its prevention is important. I am talking about early stage of disease. Now I will talk about later stage of disease. In later stage of disease, you will get multiple blood hemorrhages, and there will be retinal detachment as well. So in this kind of damage, you will lose your vision. But the good news is, early diagnosis of the diabetes we can prevent, and we can halt the progression of the disease. Important here is, we should get yourself checked every 6 months if you are having diabetes. Good retina evaluation is very important. We have multiple modalities to evaluate your diabetes. We have multiple equipments, we have multiple instruments for that. First is fundus photography. Fundus photography is very important. If you are checking your diabetes today, and after 6 months you are checking it again, that fundus photography works as a document. So you and your doctor can see the progression of the disease by doing good fundus photography. Another is OCT. OCT is ocular coherence tomography. It is like a CT scan of eye. So by that we can diagnose diabetic macular edema. Diabetic macular edema is mainly main cause of decreasing vision in diabetic patients. So diabetic macular edema diagnosis is very important, and if we treat diabetic macular edema, for that also OCT is very important. There is another modality called fundus fluorescent angiography. In advanced cases of diabetes, fundus fluorescent angiography is very important because it by angiography you can actually make a difference between early disease and late disease, because different grade of disease treatment part will be different. So diagnosis is very important in diabetic retinopathy. I'll just explain in short that there are multiple grades in diabetes. One is non-proliferative diabetic retinopathy, another is proliferative diabetes retinopathy. In non-proliferative diabetes retinopathy, we can treat it with only injections and drugs, but if it's proliferative diabetic retinopathy, then we should do conventional method like laser photocoagulation, and if advanced stages, then we have to undergo surgery. So in early disease, lifestyle modification and diet changes will resolve the disease or stop the progression of the disease. But if you develop damage due to diabetic retinopathy, macular edema will be there, new vessels will be there. So what are the treatment options? Now I will talk about treatment options. So one is intravitreal injection. What is intravitreal injection? There are specific drugs made up of anti-VEGF which we can directly introduce into the eye. So that will directly work on retina, and that will decrease the progression of the disease, and that it is very important to treat diabetic macular edema to improve your vision. So for that there are multiple kind of injections are available. First is very commonly used bevacizumab, which all must be knowing the name with comes with Avastin. Another injections are ranibizumab, aflibercept, brolucizumab, and multiple new drugs are coming in the market. So which injection you should choose? Very important. Avastin is giving really nice results, but it is not FDA approved. But if you want injection with FDA approved, then you should go with ranibizumab, aflibercept, and brolucizumab. There are other options also, in which advanced stage of disease we can treat with laser photocoagulation also. There are machines which produce laser, and that will go directly. I explained before that blood vessels and leaky blood vessels that causes diabetic retinopathy and edema and hemorrhages and everything. So to burn these vessels we use laser, and this laser will burn this bad vessels, and that will hamper your disease progression. So a laser therapy is must in many cases of proliferative diabetic retinopathy. But if you get advanced stage and you will develop retinal detachment, then what is the option? Then there is only one option. We have to undergo retinal surgery, and sometimes if you don't undergo any surgery in advanced stages, that will lead to glaucoma also, and that glaucoma, red eye and pain will be very damaging to the patient. So treatment part is very important, and you should undergo treatment at the right time for diabetic retinopathy. Information I have given about diabetic retinopathy, but why I am emphasizing it, because I am seeing patients who are having diabetic retinopathy but they don't have any idea about their disease and the treatment of the disease. Consult your ophthalmologist, consult retina specialist, and they will advise you further treatment. Go with the treatment. There is no other option than the treatment, so you should take treatment to prevent the blindness. Very importantly, diabetes and diabetic retinopathy both are preventable disease. So if you undergo proper treatment and proper management of the disease, then your eye will be your vision will be intact. We at Bavishi Eye Hospitals are treating all kind of ocular conditions. If you have any eye related problem, kindly contact us. We are happy to help you. Please follow us on Facebook, Instagram and YouTube.